Welcome everyone to another wonderful episode here, Just Podiatry. We have a young patient that we're about to embark in the correction of a deformity which the patient has been living with during the course of the last 26 years. Absolutely, 26 years. Basically, the patient was born with this, right? It's a congenital deformity. Let's take a look here, Caesar. If anyone is wondering, these little marks, we already numbed the toe. So when I load the foot, I want everyone to take a look. This is we'll just say a floating toe, right? The toe's floating, it's cocked up like that. You guys can actually see the difference between this toe and all the others, okay? What's interesting, if you look at the one on the left, okay, just so everyone can actually see the difference, right? Left is fine, but the right it does not come down. You see that? So what we're going to go ahead and do today is a minimally invasive procedure. A lot of people battle this problem, believe it or not, especially in the fifth toes. We're going to go ahead and do it just basically, it's a 10-minute procedure. We're going to go ahead and it is a hammer toe for anyone out there that's wondering. Yes, it is considered a hammer toe deformity. And what we're going to go ahead and do is basically just bring it back to here. Make it look pretty again, to make sure that the right matches the left. Simple. And simple is okay. No, again, no screws, no pins, excuse me, no plates. Patient is awake. Local anesthesia. Patient walks in, walks out. That's it. We're ready to go. As a matter of fact,
2 days later.
welcome everyone to another wonderful episode here at Just Podiatry. Case update. We have a young patient who presented to our office a couple of weeks ago with a chief complaint of a congenital deformity. The patient was born with it. The fifth toe of the right foot was basically cocked up like this. It was floating. We'll just say it was like a floating toe. It was a hammer toe, but it was also floating. In other words, the toe was not purchasing the ground. It wasn't touching the ground. And Caesar will do us the favor and obviously, incorporate the before pictures. But this is 2 days after the procedure. Today's Monday. This was done this past Friday. So we're gonna kind of just incorporate. We'll do it a little hybrid video. It'll be, I'll show everyone what it looks like. Talk a little bit about, obviously, how the experience was. The patient has been kind enough to do a little, testimonial of what we call a testimonial vlog, right? So we'll start off by, it's been 2 days, right?
Yes.
How are you feeling?
I'm feeling great. I didn't have any pain at all.
So everything was done under local anesthesia in our office-based surgical suite. What everyone what we're seeing here is we don't use any screws, pins, or plates. And this is how we hold the toe in place during the course of the next, we'll say 3 weeks. Patient is walking. The patient was able to walk in, walk out. As everyone can clearly see, the toe is now down, right? It was all the way up here. And again, you guys will see the before pictures. So, no pain. How was it? Was it what you expected? How about that?
Honestly, I thought it was gonna hurt over the weekend, but I didn't. And I went to work and everything today.
No problem, right?
No problem at all.
On a scale of 1 to 10, we'll say 10 being the worst. Today?
What are we measuring? Pain?
Yep.
I didn't have any pain at all.
At all, like a 0.
A 0 pain.
0 pain.
Yeah.
And like you said before, you're walking, no problem.
Mm-hmm. Yes.
I want to be very clear with the entire world. We had to cut the bone as well, like a little cut in the bone, to be able to really correct the deformity. Which deformity? The hammer toe deformity. So even, using our minimally invasive techniques, there's one little suture which you guys can't see, it's right here, and then there's one on the top as well. And even with that, again, you know, the patient has no pain. It's absolutely wonderful. I like to be totally transparent as well. Not everyone is the same, right? We can do the same procedure on another patient and maybe the patient will have more pain, right? So everyone is different, right? We're all different organisms, so to speak. For all the people out there that are maybe thinking about, you know, minimally invasive surgery or something as, you know, similar, hammer toe surgery, what would you say to them?
Just do it. Don't even think about it. Do it. You're not gonna regret it. It's worth it.
Okay. You know, we appreciate any questions, any and all questions from the public. I like to do these vlogs because one thing is for me, I've always said one thing is for me to say it, but one thing is for them to hear it, you know, directly from the patient. Obviously the patient doesn't want to be, you know, on the camera. So that's why we're sort of doing it like this. But I want to take this opportunity to thank the patient. I think a lot of people will benefit from this video. And then of course, once we don't really do a whole lot at 2 days in respect to removing this. We have the patient just come in for first post-op visit at 2 days, just to make sure everything is okay, no signs of infection. Talk a little bit with the patient, make sure everything is okay. Patient will be back in 1 week, and at that point we can do a follow-up video and obviously show the world the before and the after, pictures.
Okay.
Okay, sounds great.
Yes.
Super.
Thank you.
And as always, Caesar the Great, we really appreciate all his hard work and of course Dr. Nunez and the entire team. As always, thank you for watching, and we will continue to do what we do, which is change the world one foot and one toe at a time. Have a wonderful day, everyone. Thank you for watching.